Good afternoon and happy Friday. Today is October 27th and this is our Friday updates. We wrapped up our very first Emerging Leaders course. Yesterday we had 9 attendees go through the day-and-a-half course. They learned topics such as financials, how to do budgeting, regulations, the ED's role in sales, which was really an amazing session, working with your nursing staff, culture, and a couple other topics we touched upon. This course will be offered again at the end of January. If you're interested, it is for people that have not become leaders and also leaders in the first year or two. We had 2 EDs actually in the course, and they both said they wish they would have known this before they became executive directors, especially when we got into the financial piece. So again, if you're interested, reach out to Mariah and you can get on the wait list with her. The class size is limited, so you want to make sure you get on the wait list early. We also, like I said, covered regulations, and our regulatory day has been moved to January 10th, location to be determined. As a reminder, and the reason why we're having regulatory day is because the 2 focal points the Department of Health Services is looking at are both in the rules. It was just not anything the department paid attention to, oddly, so therefore providers didn't. And for one, for the trash cans with lids, the way the rule was written does make it sound like they needed to be in every apartment, but the intention was to have them out in the public areas. So lesson learned that when you write rules, sometimes you've got to think, okay, when somebody reads these rules 10 years later, how are they going to interpret them? So, that is the trash can still going in the 2-hour rule. If the department asks you for a document, you have 2 hours to present it to them. Even if you do present it within 2 hours, you'll be fine. But if you miss that 2-hour window, you will receive a deficiency, but you are still able to present them with the form. So since we're talking about regulations, let's talk about the elephant in the room. Everybody has been reading the paper over the past couple of weeks where they've been talking about assisted living within the Valley. We are working closely with our lobbyists, with regulators, with everybody to work through these challenges. As you may know, AARP is advocating for substantial changes within the regulatory framework governing assisted living. We are trying to work with AARP to kind of walk through this together, so the end is an enhanced product for our seniors. In response, I want you to know that we are actively involved. We're working on getting meetings with AARP, with the governor's office, with the Attorney General's office, to discuss these matters in detail and to clear up some of the confusion that might be taking place out there. Just some of the recommendations that AARP has offered, the Alzheimer's Association has offered, and the Attorney General has offered is improving oversight on the administration of medication within senior housing, within assisted living. They feel like communities are frequently cited for the same type of errors, so they want to close that up. They want to implement robust license requirement, which is just kind of their way of saying they really want to rewrite the rules. They want more staff and lawyers for the Department of Health Services, keeping in mind last year in the budget they received $1 million or so to increase their staff and attorneys. They want increased licensure, certifications, and regulations within the memory care environment. In assisted living, just to kind of go back in time, you have supervisory, personal, and direct. Supervisory is hands-off, and I think there's 2 supervisory communities left in the state of Arizona. Personal is where aging in place is. So if you want your residents to age in place, you have to be licensed to personal. Direct is where memory care is. That is actually the memory care level. It was set up like that in the very beginning, and it has carried it over there. Now it does say you're unable to self-direct your care. That language was intended that if you have memory care, you have to be direct. A lot of communities have licensed their buildings to direct, and I kind of see down the road that might need to change. So stay tuned for that, because we are kind of, again, talking through the department to see how everybody's going to come up on these recent, I can't say changes because nothing's changed, their recent interpretation of the rules. They want to increase more training hours for memory care than what we currently have. They want a rating system, like the department with nursing homes have their 5-star, I think it's 5-star rating system. They would like to see something like that, as well as a website. I mean, currently when you go to DHS, you have to know the name of the community or the zip code to type in to be able to see the deficiencies. They want to see something more user-friendly. And of course, we can agree with that. Anything that will help the seniors, help our residents and their families, or future residents decide where they want to move, anything that will help them, of course we support it. And then they want us to report resident injuries, which we currently is in the rules now as it is. So we have a lot going on. If this is something that you really want to get involved with, please look into joining our Public Policy Committee. The Public Policy Committee currently meets monthly, and our next meeting, we just had to actually switch, is November. The next one is November 9th on a Thursday, and then December it shifts over on time. And that's because when the session takes place, and the session starts January 8th, so our January 12th meeting will start being weekly. And we expect a very busy session this year. So if you're interested in getting involved in public policy, please reach out to myself or Belinda Ratter. Belinda with Clearwater is our chair this year. So reach out to either one of us and get signed up for this committee. It is an in-person / Zoom committee. You'll be we'll be asking the committee members to go down and lobby our legislators, the legislators in their area. We'll be asking them to have tours of their community with their legislator, so they can see what assisted living really is and how all the great work you all are doing. So if you're interested, please let me know. Otherwise, that wraps up your Friday updates. If you have any questions, please email me or call me, and just let you guys know we are working diligently on these recent updates and this bubbling up on assisted living, and we'll keep you notified of all the different changes. Have a great day, and don't forget, in just a few short days, it's trick or treat. Have a great weekend, y'all.